Neisseria gonorrhea. Now, Neisseria gonorrhea is a gram-negative cocci. Now, this cocci has a specific shape that it is a kidney bean type shape, but it is present as a diplococcus, meaning that two are present simultaneously whenever you find it under a microscope. So it looks like a kidney bean diplococci. Now, this is important because it is one of your STDs, meaning that it can be sexually transmitted. It can also be transmitted to newborn babies. How? When a mother gives birth to a newborn child, it has to pass through the vagina where this organism is present. So while passing through it, the most affected area in the newborn child are the eyes. Similarly, this results in a condition known as ophthalmia neonatorum, meaning that there will be purulent discharge present on the baby's eyes, which will make them sticky and unable to open, and they will be quite thick. So treatment for such babies is that we give the patient erythromycin. Now, other thing is that this organism which is present over here in the mother's vagina, and basically it's sexually or a sexually transmitted organism, so its specific location is supposed to be here, and it can also affect males as well, which cause urethritis. But this organism, important about this organism is that it is susceptible to dehydration as well as cooling agents. So if you keep your mucosal layer dry but not too dry, and you use proper antiseptic measures when you're cleaning yourself, since similarly you will not get this. Now, the specific features of this organism is that the virulence factor include that it's a gram-negative organism, so we know that it has an endotoxin. Now, the endotoxin in such organism, gram-negative cocci, is the lipo-oligosaccharide which is present on the membrane, which gives its endotoxin-like property, meaning that it can cause sepsis and multiple features in the body when it is disseminated from its initial location. Now, apart from that, we have IgA protease. Now, these are the proteins which are present on the outer membrane. Now, remember, all of your mucosas have a specific lining of antibodies with it, that we consider this a vagina and this upper part is the cervix. So this mucosal lining has specific IgA antibodies. Now, these IgA antibodies prevent against infection that are climbing up. So similarly, in order to prevent this organism, in order to promote this organism for attaching with these respective areas, what it has is a specific protein which degenerates or destroys the IgA antibody, and similarly this organism can adhere to such mucosas. Apart from that, it has a prion protein A, which results in serum resistance, meaning your serum cannot destroy it by inactivating what? Complement C3b. So whenever it is disseminated into your blood, this protein A helps to prevent it to be destroyed within the blood. So if it is primarily here but it disseminates in your blood system, so what happens is that this protein will protect it in the blood and by resulting serum resistance by inactivating C3b complex. Now, the other thing how it attaches to this is this mucosa is by pili. Now, the pili causes, these are like your finger-like projections made up of small proteins by which this organism can attach to the mucosal layer, and it also helps in providing an anti-phagocytic activity, meaning that it cannot be destroyed once it's attached. Now, how actually this organism can be destroyed? Our host defenses produce more IgA antibodies, more IgG antibodies in order to eradicate this organism, as well as complement binds to it, which attract neutrophils in order to kill this organism. Now, if it enters the blood, what happens? This enters in the blood in only late acting complement. Now, late acting complement deficiency is a thing in which your complement C6 and C9 are deficient. Now, this thing is present in those immunodeficient people. Another condition in which this organism can disseminate into your blood is pregnancy and menstruation. In menstruation, your immunity is slightly bit suppressed, due to which your female are more prone to it. The other important thing about this organism is that it is oxidase positive and it can ferment glucose but not maltose. Maltose is done by meningitis. This can only ferment glucose. Now the features are that this disease is asymptomatic in women. Even though it's disease more prevalent in women, but it's asymptomatic. It's more symptomatic in men. Now, if you consider this as a male genitoury organ, this is the testes and this is the epididymis and this is your long urethra. So what happens is that it can cause infection in the epididymis, causing epididymitis, and it can also affect the urethra, causing urethritis, by which there will be dysuria, meaning painful urination, and along with purulent discharge, because it's bacteria. Obviously, it has endotoxin properties and it can create pus. So your urine is white and pussy. In women, what happens is that it can ascend up to vagina, up to the cervix. Now, what it happens if it is in the vagina, it will cause purulent discharge. Sometimes it causes irritation enough that it results in intramenstrual bleeding. If it goes up to the cervix, it will cause cervicitis, and even if it ascends further, the salpinges. Now, what will happen here? That it will cause inflammation of this area, which will result in salpingitis. But because after inflammation, there is a process of healing where fibrosis occurs. When this area would be fibrosed, there will be a tendency that the female will develop sterility, obviously because the egg will not transfer here, not fuse with the sperm over here. Similarly, the female cannot be able to give births because the pathway where actually the sperm is supposed to bind to the egg is fibrosed, so there is no way for the sperm to enter. Now, what happens if this organism is disseminated into the blood? If it is disseminated into the blood from this respective area, it can go to the joints and cause arthritis, and even to the synovium cause tenosynovitis, and it can even affect the skin, cause pustules in the skin. Laboratory diagnoses include staining by gram staining of the organism. But what do we take in men? We take urethral discharge as a specimen that is supposed to be stained. But in female, we cannot take the discharge because it consists upon a lot of flora. So we will have a lot of misguided results. So what we need to culture it in order to find this organism. What we see under microscope is that, again, we see a gram-negative diplococcus. So how do we culture it? This organism specifically grown on Thayer-Martin medium. Now, Thayer-Martin medium consists upon chocolate agar. With chocolate agar is actually blood that is boiled at a specific centigrade. Along with that, we have certain antibiotics added to this medium, which consist upon vancomycin, colistin, trimethoprim, and nystatin. Now, what this helps in? This helps in clearing of all the flora that is present and not killing the organism itself. So, this is not needed for sterile fluid from joint aspiration or for blood, but this is needed only for the urethral discharge in order to overcome such a thing. So, if you from the joint aspiration we can see this, but from the urethral discharge where we need a culture in order to grow the organism or in order to see the organism. Now, the other test for laboratory is that it is an oxidase positive organism. As we've known before, it ferments glucose, but we need to rapidly diagnose it because this would obviously take a lot of time in order to culture this organism. So we use nucleic acid amplification test, which is done upon your urine or the urine of patient with both having dysuria, and similarly we get a rapid diagnosis within a few minutes. Now, what is the treatment? Treatment for uncomplicated conditions is Ceftriaxone, but if the patient is allergic to penicillin, we can shift the patient to azithromycin and ciprofloxacin. Whereas in complicated patients, whom have a low level of resistance, we can give the antibiotics such as tetracyclines and chloramphenicol.